message that has coined around the 4 issue areas to show them that, so that it is authentic. If a religious leader says something, one believes that it is authentic. If a traditional ruler comes out to talk, the community listens to that traditional ruler because he's the father and custodian of values and norms and cultures. So we have taken that giant step, and we are happy to say that we have trained them. We have now the success story about this. In Bauchi, the Emir of Das is one of our champions. We have worked with him actively, and we have seen that they have even, Bauchi says, has surpasses the 15%, even up to 16%, and they are advocating, they are optimistic that they will have more than 16% in the recent years. So you can see how actively involved. When the era of polio, people were running away from immunization, thinking that it was something that would kill their children or to stop them from giving birth. But because of the intervention of these religious and traditional rulers, polio has become something of the past. And so also that is why we have taken it to see that they are really relevant in the society and they can impact positively. And it's not that there are no challenges. For anybody to get access to these people, you will believe with me that it is not an easy task at all, but it requires patience. It requires patience. If you have passion, you are passionate about your children and women, you are passionate about their health status, for sure you will become patient. Even no matter the stress, you will stand it so that you succeed and to see that these children live a healthy life. And to move forward, there is now a brainstorming issue between the Christian and Muslim. It has promoted unity. This very project has promoted unity between Muslims and Christians. You will see that in all the 8 states, I can walk comfortably and go and sleep in one of the Christian houses because of this unity. It promotes peace, and we can see as a result of that, people have come to stay together. We are always advocates, thinking of peace, peace, peace. And this is how peace comes about. We are going to sustain, we are still brainstorming between Muslims and Christians to see that we sustain this. Even beyond this project, we want to sustain it. We are still brainstorming. And at the end of the day, inshallah, we will succeed. Thank you.
Thank you very much, Hajia. I can see the passion in you. I couldn't even stop you. So I'm apologizing to the other panelists. I gave you her extra 2 minutes. The last, as I said, the leader of the panelists, Dr. Omowumi Olabalu. Please, let's hear from you.
Thank you. Good afternoon, everybody. Please permit me to stand on existing protocol. I'll be rounding up, like giving an overview, basically, of PACFaH and what we've strived to achieve over the last 3 years. The first thing to note is that PACFaH is the Partnership for Advocacy in Child and Family Health. The P in PACFaH, we say, stands for partnership. We are discussing as a country towards achieving universal health coverage. And PACFaH has realized that to achieve universal health coverage, you require partnership. It is said that if you want to go fast, you go alone. But if you want to go far, you go together with others. PACFaH has worked over the last 3 years in partnership with the government, with the religious leaders and religious institutions. And PACFaH has brought together civil society organizations towards achieving universal health coverage. We've identified that the same problem cuts across all, whether it be pneumonia and diarrhea, whether it be family planning, whether it be nutrition. Just name the issue in health. You will trace it to policies, and you will trace it to funding. For advocacy to be successful, advocacy looks at these areas, and advocacy tries to achieve a common ground with the advocacy targets on the advocacy asks. A landscaping study was done sometime in 2014, and it was found out that civil society organizations in Nigeria approached advocacy on an ad hoc basis. Advocacy was not professionalized, and that formed the basis of developing the PACFaH project as we know it today. PACFaH project sought to build the capacity of indigenous civil society organizations to become advocates that were clear on their advocacy issues and that they could get results that they wanted. So what is unique about the PACFaH project? PACFaH project is unique because it focuses on indigenous civil society organizations. So we can see that everybody today on the panel are indigenous civil society organizations who are passionate about the issues and they understand the issues and they are willing to get the solutions to the issues. We have seen, and it's been noted repeatedly, that indigenous civil society organizations increase the chances of sustainability in any project. It's also been noted that working with indigenous civil society organizations give you a higher likelihood of achieving your advocacy asks and demands because of their good knowledge of the background, the issues, the advocacy targets, and local context. So PACFaH has worked with indigenous civil society organizations in the last 3 years, but the strategy has gone beyond that. PACFaH also worked on the supply side, working in partnership with prestigious government agencies like the NIPS, National Institute of Policy and Strategic Studies, and the NILS, National Institute of Legislative Studies. PACFaH has worked with in-government champions and bureaucrats to engage on the advocacy issues. It's been noted by the advocacy target that one of the things that worked best was being immersed with the topics in advocacy materials, media coverage, and all that could not have been possible without capacity building of the indigenous CSOs in Nigeria. The PACFaH project is also unique because it's a project that keys into capacity building as a key component of the project. And the civil society organizations have mentioned that the capacity building made the difference. And we recommend that should anybody want to try this again, capacity building must be a key component. Lastly, I would mention that the successes of PACFaH today, I've heard people say that it takes 20 years to achieve policy change. It takes, sometimes you don't see it in a lifetime. But working together in partnership with government, with the local CSOs who are passionate about this picture, with the traditional and religious institutions, it brings everybody to the table to have a common understanding of what the issues are, towards resolving it for what we all want. Universal health care. We want no mother and child to die. We want every Nigerian to have access to health in an affordable way, in an accessible manner. So I would conclude by saying that the successes we have today in PACFaH of policy and of increased funding, we have the nutrition policy being implemented. It's very interesting to note that before PACFaH, we were able to show that the states were not even aware of the existence of this policy. It was a policy that had been shown that if this policy is implemented, it will reduce deaths from nutrition to a very high proportion. We had challenges with family planning funds released. We had, like you mentioned, the pneumonia and diarrhea. We all knew what the solution was. The treatment guidelines had been clear, but the policies in Nigeria had not been updated. PACFaH was able to achieve all this because of one voice advocacy. Everybody marched together with a common message, with a common theme. And as the project rounded up, we gradually included in our messages an increase in the total health budget. Because we understand that once there's funding for all of health, then a lot of our problems will start getting solved gradually. So as I conclude with partnership makes the difference. We will go far if we all work together, with government, civil society, traditional and religious institutions, and that today is the PACFaH story. Thank you very much.
Thank you, Doc. I love your statement when you wrapped it up. If we go together, we go far. I think I love that very much, and that's actually what we are doing here. So Right now, it's going to be more like an individual thing because we have series of questions we'll need to ask here, and whichever of the panelists that wants to answer, it's more like a guided question. So you check it out. By the time I read it out, any of the questions that actually touched you in your course of trying to meet up with the objectives of PACFaH, then you talk about it. So I'm like going to give you a minute. The guided questions are, what were your objectives? How were they to impact on child and family health? Then 2, what did you accomplish? 3, how did you do it? What were the mechanisms of your work in this space? What main areas were challenging? How did you manage these challenges? What are your next steps in your work? Then in the concluding question is, of all the things we've discussed today, what would you say are the most important issues? And we have just 20 minutes for that. So I'm giving us like 30 seconds. Think about the question, and anyone that is asked, anyone among the panelists that wishes to answer should just indicate.
Thank you very much, the moderator. Ladies and gentlemen, I think it's like distilling all this thing together too, so that we can have a sharp focus. But I think for us, in the HEFON PACFaH project, the objective, anything? All right. The objective is very clear, to ensure that the states where we are concentrating are in line with the family planning national objectives. The states where we are concentrating are discharging on the national family planning strategy and policy. That's very simple. Then what have we done? Because we have realized a need analysis at the beginning of the project, which she has, Dr. Lavalu has alluded to, of the gaps that are there. So what we have done is to then go in there and try to build alliances. One, to establish very strong advocacy system and mechanisms, working with the local partners in these 3 states. And we didn't actually reinvent the wheel, but we managed to latch on the wheel and strengthen what we believed needed to be strengthened. The biggest challenge that we have, of course, as usual, is the challenge of non-openness in our system, especially when you are dealing with government agencies. You come to a place, you want to get information so that you can move ahead, or you want to see somebody. It is difficult. Let me say this is a varied, successes here. There are some states where we go to, it's very easy for us. I must establish that, and then we're able to see them. There was a particular state we went to, wanted information. They told us that we cannot get information. We charged for Freedom of Information bill, and they told us that it's not stepped down in the state. So there's nothing you can do about it. I think that issue of openness is something else. Then the issue of transparency, even when the funds are given, you want these funds to be put in the budget. If they are put in the budget, are they released? If they are released, are you sure they are spent for what they are spent for? If they are spent for what they are spent for, are you sure you are getting money for the value of what you are doing there? And I think these are there. To us, our next step is, as project is moving ahead, is to ensure that we maintain the sustainability of the coalition at the local level. It's not about CHR or HEFON or CSON now working. They will all go one day, or they might focus on another thing. PACFaH may focus on another thing. But what are we leaving behind for the state level or the local level structures? I give an example in Oyo State, for instance. I think my time is gone. The Oyo State, for instance, we had a lot of village level coalition bodies that were coming around, and we were able to speak with them. We were able to work with them, along some of our partners that made direct service delivery intervention in some of the health facilities. I think these are areas people see, and they see that they can actually create sustainability. I think that is very important for us.
I just want to add that the issue of bureaucracies in, as we see it in government offices, we've been able to go around it by identifying and working with in-government champions. Now, before now, CSOs were seen as activists and antagonists who are just there to find faults in what government is doing and then go to the press and publicize it. Now, under the PACFaH project, we have come to show that CSOs can be partners in progress. And so we are working with government in implementing whatever it is we're implementing. And we have been well accepted in both at national level and in the state where we are working. And also to note that, yes, you find fault with government. It is one thing to find fault in what they are doing. Can you proffer solution? Can you support government to do what the needful is? And that is where the capacity building efforts has come in. We identify problems along with people who work, in the various MDAs, and then we find solutions for those problems. So we have found also weakness in terms of intersectoral or multi-sectoral collaboration. When we talk about nutrition, for instance, no one sector has the solution to nutrition problems in Nigeria. It has to be a multi-sectoral effort. And so we have also worked with the coordinating ministry to strengthen the capacity of members, for example, members of the National Committee on Food and Nutrition, as well as the state committees on food and nutrition, so that they understand what their roles are within the national policy and within their state-level plans of action and so on. And we find that this has worked very well. Also the media, not only for them to come and cover this event that is taking place, they need to know about, effective reportage, and therefore we built their capacity as CSON to recognize what is it that people will want to see that can move them to do what they need to do. And so this partnership has been very, very effective.
Thank you so much. But I think just one other panelist she'll just speak, because we need to have time for the audience to ask questions, please.
Okay.
Thank you.
Thank you very much. In my first discussion, I said my association is very concerned about the situation of family planning in Nigeria because women are dying. So access was a key issue for us. Creating access for family planning was a key issue for us. So because we now went and did an assessment and noticed that over a period of 10 years, there was no change in terms of what we call the contraceptive prevalence rate. That is, the proportion of women who should use family planning as against who are using it. And also that the unmet need, those who have a need to use it but are not using it, is even higher than those who are using it. So we got intrigued and said, what should be the cause of this? So we set out to say, basically, we want to do things that will increase the access to family planning. Then secondly, we said, let's find out what is going on. We did a scanning and assessment of the entire Federal Ministry of Health to articulate those issues that affect what is happening around family planning. And we came up with 7 issues. But funding was highest on the priority, and then regulatory issues. So what we did was, we did national dialogue to address funding issues for family planning. And a lot of stakeholders came, looked at the situation, and proposed solutions in terms of what the government can do. The same thing with the regulatory issues. So we packaged the outcome of these national dialogues and presented it to the Honorable Minister for Health. Now, before this administration, the government had committed to providing $3 million out of the over $11 million required for the country to procure contraceptives for the country. So the government said, we will give $3 million, because before then, government was not contributing. It was just donor agencies contributing. So with these advocacy efforts we did, the present administration has increased it from $3 million to $4 million dollars. So for us, it's a big success. Now, from what we also did, we got the civil society organizations at the national level to come together, and we did capacity building in terms of advocacy, in terms of budget tracking. It was the first time they were open to what advocacy really is. What they were doing before they realized was just courtesy call. But this is a scientific way of doing advocacy, the smart way of doing advocacy, and they became alert and alive to issues around budget and budget tracking. It's the way of making a case for whatever they are doing. The challenges are, one is that the bureaucratic nature of our government makes advocacy more time consuming. You may have, you may be given a date, an appointment for advocacy, and that date is changed at the last minute. You have to 3 times or 4 times the same thing. So it's really challenging because you have planned what you will do, and then you try to do it 4 or 5 times and without success. So it was a big challenge for us. We also looked at, the other thing that was a challenge was tracking the expenditure. You can get the money that was proposed and enacted. You can, not with too much difficulty, get the release, but getting the actual use of the money is like a no-go area. You can't really know how much was spent out of the amount that was. So it became challenging in the sense that we can't categorically say that, yes, this money was released, but was used for a family planning. So it was also a challenge for us. For us, the most important issue is to continue in this effort, because we have had a good success story, because in this year's London Summit, the government has made 12 other commitments for family planning, which we are going to pursue. And it cuts across many line ministries. So we have to spread our advocacy efforts to different line ministries that are responsible for making sure that the government of Nigeria will actualize all these commitments made at the London Summit. So I'm told that I don't have too much time again.
Thank you, Madam. Thank you. I'm sure some of the issues that we wanted to talk about could come up from the questions asked. So we are going to throw it to the audience. We need 5 persons. We are going to entertain just 5 questions. Please, okay, sir, you're number 1. Madam there on yellow, you're number 2. Brother on blue, you're number 3. Let me go to the back a bit. You're number 4. And, okay, Madam, you're number 5 with a blue shawl. So please, number 1. We'll take all the questions. I think that would be better. We'll take all the questions. Then the panelists would. Okay, questions, comments, contribution. But let's make it brief, please. Yes. Thank you.
Let me first of all thank the panelists and then, of course, the conveners of this dialogue. Mine will be a question and then also a comment. Let me start from the, let me just do the comments only. My comment would be, we've heard the wonderful stories that came out of the panelists in this dialogue. I would want to hear more from them, those glues that glued us together as partners, in order for us to be able to see that this is a very wonderful way for civil society.
Excuse me, sir. Sorry for interrupting you. Please, you introduce yourself.
Okay,
and
I'm sorry.
Thank you.
My name is Dr. Ejike Oji. I'm the chairman of Association for the Advancement of Family Planning in Nigeria. Our association is one of the members of the PACFaH. We are the lead on family planning. So let me go to my comment. I said I would like to hear more from the panelists, those things that they did together that made this project a wonderful project. If you have been long enough in the development space, you see there's always a competition between CSOs in terms of doing the same work. But this is a project that all of us are so proud of. I can tell you a quick outcome, the ones that we participated in. I remember when the 2016 budget came out, and then we looked at the budget and found out there was zero allocation to the midwifery service scheme. And then all of us, PSN, AFP, CHR, all of us worked with one voice. And then we went to the National Assembly, made the Senate Committee chair, made the House Committee chair, and with that, we were able to get that reversed immediately. So those are the kinds of things we want to hear. You guys are doing a great job, but I think this project is about how we partner to do more. Because we, like she said, if we work together, we go the mile. Then my final comment will be, I hope Gates will not run away after this, because we've shown that it works. There should be a build-up on this for us to continue to do the wonderful work that we do. Thanks a lot.
Okay, good afternoon, ladies and gentlemen. My name is Chinyerugo Chumba. A big thank you to the panelists for a job well done. I have two questions. Number one question is this: looking at the panelists, I think aside from HEFON and Form 1, most other of the panelists, their organizations are stationed in 1, 2, or 3 states, which are their core areas. Now, there are so many states that perhaps don't have a platform like this. What happens? How can they replicate what has succeeded in other states, in their own states, when they don't have a platform like this to leverage on? That's the first question. My second question is, I've heard a lot of talks with what Dr. Magashi said and so many other comments about the area of training the local CSOs. But I really want to understand what is the plan in terms of ownership so that this project can be sustained. And I'm worried because of an experience I had. A project that finished, I was part of those who went to a community where they helped in putting up a health center, equipped it and everything. And the project is over. But I'm also a journalist, so I went there to do like a follow-up story on what I did there. And when I got there, what I saw was shocking. The building was dilapidated. You could see so much money that was spent. Everything was a waste. The whole place was in ruins. You know, even the clinic was open. The children in the community could have access. You have needles and syringes exposed, drugs exposed, so many things exposed. And you now ask yourself, if organizations will spend so much to do their project within the time the project is on, and you will agree with me that after a certain period, projects end or organizations move to other things, what is that plan to sustain what you have started or what you did? And what is the plan to create concrete ownership so that when projects end, it wouldn't be that all that was a waste? Thank you.
Please, I plead that we make our questions or contributions as brief as possible, please. Thank you.
Good afternoon, all. My name is Comrade Musa Musa. I'm one of the members of the coalition of AFP. First, I want to commend the PACFaH for their wonderful job. And second, I want to also say that Madam Chingwe has forgotten one thing, because in the history of this country, it's only this program that was able to successfully mainstream persons with disability into family planning. So it's a great thing that at least we need to appreciate. Secondly, one of the sustainable plan or framework that AFP did was to train a pool of advocates from state and national, so that if this project ends today and PACFaH say they don't want to do this again, those guys can still maintain it at the various states. So my question now goes, one, to the CHR. Wonderful story from the Minister of Health, which you confirmed about the social story in Bauchi. My question here is, as a civil society person, I like success stories. What have you done different that you got this? We want to know so that we can also follow the moving trend. Secondly, to the whole panelists, please, what is our sustainable plan and framework? Thank you.
You can give to Madam on blue. I know she's the last person, but give her before you go to behind. Don't worry.
Good afternoon, ladies and gentlemen. Please permit me to stand on the existing protocol. I have to commend all the panelists for bringing us to this enlightenment. And also I want to appreciate Bill and Melinda Gates, PACFaH project, for the enlightenment also and what they have brought into the community. My question goes to Dr. Banida and Dr. Chinwe on family planning. Family planning is as far as existence, because while we were the first set of family planners in Kwara State as far back as 1986, and what we were told then to preach was child spacing. But from Dr. Banida's speech, you are telling us of population explosion by the 20 years' time. So I want to know, is family planning now to prevent population explosion or child spacing? And again, we have two challenges here, which we have forgotten to mention, the religious challenge and also the cultural challenges. It is very vital, because religion has been a great challenge in the course of family planning, and also culture. Because as Haja Form 1 spoke, Haja Adam Akachala from Form 1. Form 1 cannot go ahead to preach family planning as don't have such number of children. We preach child spacing. And child spacing because in the Quran you are allowed to breastfeed your child up to 2 years. So please, this is what I want to know. What do we preach to the community? Is it population explosion or child spacing? Thank you.
Good afternoon, ladies and gentlemen. I stand on all existing protocols. I'm Tony Okpeli and I'm a mental health advocate. I'd like to start by commending the efforts of the organization in actually bringing, as one of the panelists said, that's something we don't do very well, partnership. So I'd like to commend the efforts. And I have a question in terms of determining the processes that were involved in determining the civil society organizations that were involved. I'm assuming there might be other organizations that are involved in the same line of work. So how it was determined, the specific partners. And my second question as a mental health advocate, mental health is very central to our health and well-being, whether the family or individual. And I just want to find out what you have done or what you are looking to do in terms of mental health. Thank you.
Thank you for the wonderful questions. So I'll respond to the question on the community groups that have already built their capacity, how they are going to sustain and own the project. As you listen to the different panelists explaining their work in the PACFaH, you understand that all of us, despite having different thematic areas, 4 thematic areas, family planning, nutrition, pneumonia and diarrhea, and routine immunization, we are also mandated to build community groups, local groups within our states where we are working. The purpose of that is for sustainability and for ownership, so that when the PACFaH project is no more there, you can have those groups continuing the advocacy work, continue their engagement until we have the request met. For us in PSN, we are working in Lagos, Kaduna, Kano, and at the national level. And we have state coalitions in those focus states. Our coalition, after building their capacity, they now appreciated the importance of doing advocacy and creating awareness in the community about these killer diseases. We have some of them represented here. The chair lady from Kaduna, she's here. The secretary from Lagos. Those from Kano too, they are also here. Since then, we have been having them going to do activities. In fact, last 2 months, we have report from them in Kano. The CSOs, they are involved in other projects. One of them got a grant to do HIV/AIDS campaign, community mobilization. They called us. after the capacity training that, see, they have these grants to do HIV/AIDS. Can they include pneumonia and diarrhea during their campaign? We were so excited. They didn't even tell us to mobilize them or give them transport or anything. They said they want to include that in their campaign in the community. And that's that's a key success story. And we have had similar requests from the groups in Lagos, in Kaduna, even at the national level, requesting for materials for us to give them content that they are going to the community to do another activity. But then they want to include pneumonia and diarrhea because they have come to appreciate from the capacity building training that there is need for them to mobilize the community, to sensitize them, to help them to come out from issues, to reduce the mortality rate from pneumonia and diarrhea. So we believe, even if the project stops today, those capacity building that we have done for those groups in our focus states, they are going to continue those activities. They are going to continue the pneumonia and diarrhea advocacy. And I believe it cut across all the different issue areas, those in nutrition, family planning, routine immunization. The groups that we have already built their capacity, they have already owned the projects, and they are going out of their own way doing the advocacy and giving out the report. Thank you.
Okay, thank you, Mr. David. For want of time, we are going to wrap it up, and we'll ask Dr. Omowumi, who is the lead panelist, to summarize answering all the questions. So please, Doctor. Go ahead.
Okay. So we have experts
Okay.
on this
We'll
panel.
give you the.
Hold on, just a minute. No, I won't round it up. With your permission, I think I would like to recommend that because of the expertise of the team on the table. Now, I know Mrs. Eloaka has experience already scaling up the messages outside the states. I would recommend she takes the states that don't have a platform like this question. Dr. Magashi, you have a direct question. What was done differently in Bauchi? You've also had a lot of experience and stories to share on ownership after PACFaH, especially with the platforms that you're working on. Dr. Abanida, you definitely own the question to prevent population explosion or the child spacing question. I think if someone could just help us chip in with your experiences. The processes in determining the CSOs that were picked, we really don't have time to go into that now. So maybe if you could see me after, I could explain to you. But there was a landscaping study. It's enough to say that. So we looked across so many parastatals, advocacy, service delivery, so definitely mental health propped up. So because of time, that organization is DRPC. DRPC is the coordinating body for the PACFaH project. So I would like the panelists to quickly address the questions. If we have time, maybe Madam Chinwe could chip in into the family planning bit. So we'll start on the right.
Thank you, Dr. Olabalo. Thank you very much, ladies and gentlemen. I want to explain on sustainability after this project closes out. Form 1 has the chairman Khan, Christian Association of Nigeria, Khan, Dr. Ray Minor from Bauchi State, and Dr. Fatih Shehu. She's the Director of Primary Health Care in Niger State. The two are working seriously to see that what we are working on now on this project is sustained. Because, yes, should be sustained. So they are now seriously working on it. That is to say that it's not going to pack out. There is sustainability even after this project. And secondly, the issue of family planning. I have told you that Form 1 has built the capacity of religious and traditional rulers. We brought 24 of them under one roof. This very book, material we are seeing, inside it has explained these 4 issue areas, quoted from the Bible, Holy Scriptures, and the Quran, the verses and the text from the Holy Quran. They sat under one roof and brought out all the issues of family planning. There is now child spacing, because what this name family planning scares people. People are getting scared when they hear family planning. So it is now we are saying family planning in bracket.
Okay, Hajia, thank you.
Yes,
Let's please quickly.
Thank you very much. I think I would have loved this question to be answered by Dr. Oji, but it's on the other side. Ajia has been one of the unsung heroes in family planning, and I've known her now for more than 30 years. Having said that, You are dealing with an issue that is an issue in family planning, space, family planning environment. You have the pronatalist and you have the antinatalist. We are living in a multicultural environment which has to be managed as such with all these complexities. I'm going to do two things. One of the aims of the family planning is for child spacing so that you can have qualitative human beings. You can have qualitative human beings. I think I won't go beyond that. The other one is the issue of absolute figure. What I'm going to say now, some of you may agree it is very agreeable, but I have done a lot of works on absolute figures and absolute population. We have heard that the total fertility rate in Nigeria is almost about 6, as compared to a place like Indonesia or Malaysia that's about 2 or 3. These are regions also that have almost the same religious complexity as Nigeria, but there are a lot of innovation going on there. There is a good correlation between the absolute number of people you have over a land space and when people are not even doing things properly and IQ. There is a correlation between the total fertility rate you have and innovation, ability to innovate. People have argued that is that the reason why a place like China with total fertility rate that was almost going below 1 have been able to come out with a lot of innovation in the past 30 years. All these are questions that beg for answer. But Ajia, to answer your question simply and to move forward is that we are not saying that people should not deliver. No, that's not the message. What we are saying is that if you got to deliver, make sure that you space your child so that you can have the space to manage your economy within your child spacing environment so that you don't have your 3 kids, they are looking like triplets. That's not going to be very good for you. But again, we need to be very careful. You cannot run, if you want Nigeria to have a population of over 400 million people by 2040, so many other things have to co-move to manage it. If things are not co-moving to manage that high-falutin figure, that explosion that is going to come in the next 25 years, we are going to have something else.
Thank you, sir. Thank you very much.
So, thank you. In just 2 minutes, I will answer all my 1 minute. I will answer my question in a practical way, the ownership and sustainability. Can the coming person stand up, please? Kadmam, Ajia, let them see you. Basam, Amkas Alkali, Amkas, Basam, please. These are the ownership and the sustainability. Oh, okay. They are already here, and they will continue the flag of the advocacy. Kadmam is even going bigger than CHR in Kaduna. They are all over the place. So we are confident that this will continue with the mentorship, and also as more partners and programs are coming in, they will continue to work with this organization and continue to build their capacity in a practical way. The issue of the Bauchi State 16%, Operation Catch Them Young. The governors, as they are coming into election, grab them, show them the advocacy and the value of what they need to do, the incentive for them to do the work, the leverage, and also how they become more popular when they deliver the promises they have made. So you need to catch them as they are elected into office 7 days. Don't waste any time. Get in and commence your advocacy. Thank you.
Thank you, sir.
I think Dr. Magaji has answered part of the question I should have answered. The second part is where the states where PACFaH is not working. What are we doing? For us at CSON, we have local working groups in 12 states already. So we're looking for funding from elsewhere to support what PACFaH is doing, and doing the same thing we have done for the PACFaH focus states in those states, building their capacity, mobilizing them to have a strong, local working group. Hopefully, when we expand beyond the 3 focal states, what we intend to do is to graduate these local working groups into state chapters of civil society scaling up nutrition. Within the states, we have a compendium of who is working where, what the CSOs, the various CSOs who say they are working in nutrition, what they are doing, where in the states are they working. That way we can begin to hold people responsible for continuity of what we have started. And I must say that it's working very well. For instance, in Kaduna State, they were invited to a meeting and they called us at headquarters. And